Celecoxib is a cyclooxygenase 2 selective, non-steroidal anti-inflammatory drug with anti-inflammatory and analgesic activities. It has been shown to be effective in managing acute pain in adults caused by post-orthopedic surgery, post-oral surgery, and primary dysmenorrhea. Celecoxib has also demonstrated efficacy in reducing chronic pain and inflammation due to rheumatoid arthritis, ankylosing spondylitis, and osteoarthritis. Worldwide, several 100 million people suffer from osteoarthritis and rheumatoid arthritis. As the population ages, more people are expected to develop pain and functional impairment related to arthritis. Non-selective NSAIDs that deactivate both the COX-1 and COX-2 enzymes have traditionally been the mainstay of clinical care for patients with arthritis. COX-1 in the stomach wall produces prostaglandins that stimulate mucus production. Therefore, non-selective COX inhibition disrupts the mucosal integrity of the gut and is associated with complications such as peptic ulceration and dyspepsia. To minimize the occurrence of GI complications, physicians often prescribe proton pump inhibitors in combination with non-selective NSAIDs. PPIs protect the GI tract by reducing acid production and in turn damage that occurs when the gut has lost mucosal protection due to non-selective NSAIDs. It is important to note that non-selective NSAIDs are associated with ulcers and other complications in both the lower and upper GI tracts. Although PPIs may be prescribed in combination with non-selective NSAIDs, their effect does not extend beyond the first section of the small intestine, the duodenum. Therefore, the lower GI is still subject to the loss of mucosal integrity, resulting from the inhibition of COX-1 activity. Celecoxib is believed to inhibit prostaglandin synthesis via the inhibition of COX-2, which is specific only to inflamed tissues. As a result, celecoxib's COX-2 specific mode of action is not associated with a compromised mucosa, so there is a lower risk of GI complication. Previous NSAID studies were limited to looking at GI outcomes such as perforations, obstructions, and bleeds, only in the upper GI tract. There is evidence, however, that the adverse GI effects of NSAIDs occur in both the upper and lower GI tracts. A new study was needed that considered the effects of treatment strategies on the entire GI tract in arthritis patients. CONDOR is the first large, randomized GI outcome study using a novel composite endpoint encompassing the entire GI tract. The composite endpoint was designed to compare two common treatment strategies for arthritis patients: celecoxib, a COX-2 selective NSAID, versus diclofenac, a non-selective NSAID, combined with omeprazole, a proton pump inhibitor. CONDOR was a 6-month, prospective, double-blind, randomized clinical trial in subjects with osteoarthritis and rheumatoid arthritis who are at increased GI risk. Patients were randomly assigned to the two treatment regimens, celecoxib or diclofenac plus omeprazole. To be included in the study, patients must have been negative for Helicobacter pylori and be 60 years old or older, or have a history of gastroduodenal ulcer for 18 years or more. Patients taking aspirin or other antiplatelet drugs were excluded. The CONDOR study used a primary endpoint, Casolges, that was a novel composite of clinically significant upper and lower GI events. An independent, blinded committee adjudicated each endpoint event, and data were analyzed using a life table method. Results from CONDOR showed that there were significantly fewer GI events in subjects taking celecoxib compared to those taking diclofenac combined with PPI omeprazole. This difference was statistically significant at a hazard ratio of 4.32. The CONDOR study, using a novel composite endpoint, was designed to examine both the upper and lower GI events in arthritis patients taking COX-2 specific NSAID celecoxib alone compared to those taking non-selective NSAID diclofenac combined with PPI omeprazole. Now, with results from the CONDOR study, physicians can make better decisions in developing a treatment strategy for arthritis patients. Treatment that will consider both efficacy in relieving pain and reduce risks of both upper and lower GI adverse events.